Hi guys, this is Keshav from Doctor Behind the Scenes, and today we have a very special guest, that is Dr. Aditya. उनकी introduction की तो I don't think कोई need है. He did MBBS from AIIMS Delhi, then he did his PG from AIIMS Delhi, and currently doing his DM Pediatrics from AIIMS Delhi itself. So hi Bhaiya, hi, how are you?
I'm all right. कैसा है केशव?
I'm good. तो और बाकी how's DM life going? Hectic की is normal? Okay.
अभी तो थोड़ी I'm currently posted in NCI National Cancer Institute Judger. तो comparatively थोड़ा relaxed है because we get weekends off. But otherwise तो DM तो hectic होती है obviously. You can't expect DM not to be hectic. But I will say that DM is slightly less. I feel it's slightly less hectic as compared to MD. MD used to be much more hectic. And obviously MBBS से comparison तो कुछ है ही नहीं. MBBS तो मस्त होती है, जिंदगी चल रही होती है. वो है. But yeah, but I enjoy it frankly.
At least
you're doing your DM
some off, right? कुछ तो छुट्टियां मिल.
हाँ, अभी मिल रहा है यार, सिर्फ इस महीने की बात है.
But ऐसे की पोस्टिंग हो रखी because of that.
हाँ, yeah, because जजर है तो वहाँ का सिस्टम थोड़ा ऐसा बना हुआ है, but मिल जाते हैं ऑफ्स. But otherwise तो कोई वीकेंड ऑफ नहीं मिलता हमें संडे को भी जाना ही होता है mostly. But I'll say that DM is slightly less hectic and you enjoy DM. I personally enjoy my DM more as compared to my MD. I don't know about other people. Someone might enjoy their MD more than their DM, but मेरे को अपनी DM ज़्यादा enjoyable लग रही है as compared to my MD.
Okay.
तो क्योंकि ज़्यादा enjoyable लग रही है इसलिए शायद hectic भी कम लग रही है.
Obviously.
हो सकता है ना?
Exactly. So before starting with the proper topic, what's your views on FMG, like foreign medical graduate, the students who go to Ukraine or Russia and then come back here and give FMG? What's your views?
So मेरा सबसे पहले एक personal interaction एक FMG के साथ, I met someone who was doing his JRship, junior residency, non-acad in community medicine जब मैं intern था. Obviously पहले 4 साल तो मेरा अपनी MBBS में जो अपने लोग हैं उनसे इंटरेक्शन हुआ था, बट उस समय मैं जब कम्युनिटी मेडिसिन में विलेज में पोस्ट हुआ था तो वहाँ पे नॉन अकाड की तरह ही था. सो आई आस्क्ड हिम कि सर आपकी MBBS कहाँ से है? सो ही सेड दैट मेरी MBBS यूक्रेन से है. ही वाज इन फैक्ट फ्रॉम यूक्रेन. सो आई फ्रैंकली मतलब मेरे को ना एक्चुअली उस पॉइंट ऑफ टाइम पे इतना आइडिया नहीं था कि दैट पीपल एक्चुअली गो. आई न्यू दैट पीपल डू गो टू रशिया, यूक्रेन एंड चाइना, बट कितना पोर्शन है कैसा है मुझे नहीं पता था. बट मेरी उनसे जितनी इंटरेक्शन हुई थी, मेरे व्यूज FMG से उनसे ही फॉर्म हुए थे बिकॉज आई फाउंड हिम टू बी वेरी नॉलेजेबल. बट ही हिमसेल्फ सेड दैट ही टोल्ड मी दैट FMGs को तुम इमीडिएटली 2 ग्रुप्स में डिवाइड कर सकते हो, जो थोड़े से बहक जाते हैं एंड जो पढ़ते हैं एंड मेक द बेस्ट ऑफ देयर अपॉर्चुनिटीज. एंड आई थिंक दिस इज प्रीटी मच वैलिड फॉर every medical college in this country, including AIIMS. I'll be very blunt about this. Okay, so getting to study in a medical college, be it a government medical college, be it a private medical college, or being in a foreign medical university, is an opportunity. Okay, and what you make of that opportunity is obviously dependent upon you as an individual.
Yeah, that's
right. So I found him to be very knowledgeable. I'll tell you something. He is currently अब तक खत्म हो गई होगी. So that was back in 2017. He did his orthopedics from LHMC. So a lot of people keep on commenting, can a foreign medical graduate get a good PG medical seat? And I have found, and not just him, there are many people who are here in AIIMS itself, AIIMS Delhi by the way itself, who are foreign medical graduates. I have actually done one interview with Dr. Ashwin. He's currently pursuing his MD in geriatric medicine. And geriatric medicine. In fact, yes, I think you should put the link of that video in the description. He's one of the most knowledgeable. He did his MBBS from Russia. He's in fact one of the most knowledgeable, most one of the most sweet person, most knowledgeable, most finished I'll say persons that I have actually met. Okay, and so he did his MBBS from Russia, and that did not hamper his future, his goals, his aspirations. He's doing his MD in geriatric from here, and not just him. There are other people in other departments as well, be it surgery, be it emergency medicine, who are there in AIIMS Delhi itself. So one thing, if anyone, and they're FMGs, proper FMGs, either Ukraine, Russia, China, Philippines, whichever you want, country you want to name it. So if any foreign medical graduate is watching this, I'll say that there's a tendency to consider that, you know, maybe we won't be able to crack. So ऐसा नहीं है. It's all an opportunity. It's all your hard work. Everything fails. एक hard work के आगे सब कुछ fail कर जाता है. So put in that hard work, and it's absolutely rubbish कि तुम ये नहीं clear कर सकते या कोई ऐसा बोल रहा हो तुम्हें ना तुम ये नहीं कर सकते हैं, something like that. तुमने अगर if you put your hard work, there's absolutely nothing in this world that you cannot clear as far as an entrance is considered.
That's true. That's true. And I think ये question इसलिए बहुत is very common कि FMGs can clear PG or not, because I think कोई है ही नहीं YouTube पे, like I know one
जो बोलता है कि मेरा clear हुआ है.
हाँ.
I think Dr. Milind is there. Dr.
Milind is there. I said only one person I knew. Dr. Milind is there. That's it. And there is no one else. इसलिए this question is very common कि because they knew कि he or she cleared FMG. Okay, and then he's gone because there is no interview, there is no like any session or something. So FMGs में confused आते कि उनका क्या हुआ आगे? Are they doing the like they are pursuing their job or they are pursuing PG or what are they doing? वो बच्चों में confusion.
तो पता नहीं चलता. In fact, you know, talking to you, I actually now realize जब मैं US गया था ना, when I went to my Hopkins elective, research elective at Johns Hopkins. So वहाँ पे the person who was doing observership with me, she did her MBBS from Mauritius, gave the FMG, worked in an Indian hospital system for 1 year, and then she went and she matched in Hopkins. मतलब तुम सोच सकते हो. So there is absolutely nothing in this world that you like foreign medical graduate. As if, you know, it's an opportunity. What you make of that opportunity is what defines you, basically.
That is true, yeah. And plus, FMGs got a little extra time to study, I can say, for enjoyment of study, because in India, it's 5.5 years, right, MBBS. And in Ukraine or Russia, it's 6 years. And then we have to do 1 year internship in India itself also. So it's 7 years and 6 years in their country. So we got 1.5 year extra for preparation. So if someone is willing to prepare, obviously वो करने के लिए तो करेंगे.
They can यार मैं in fact ना कोई मेरे को एक जमाने में किसी ने मतलब ये लंबा जो है ना लगता है लंबा है very frankly, but in the long game 70 साल की 80 साल की हमारी जिंदगी में ना ये 1-2 साल matter नहीं करते. मतलब so मेरे दिमाग में ना जब मैं मेरी MBBS में 3rd year में था तो मेरे जितने भी दोस्त थे उनकी ग्रेजुएशन हो रही थी जो DU में थे या IPU में थे या like normal यूनिवर्सिटीज में थे, and I was just in my 7th semester. मेरी तो आधी MBBS बाकी थी, 5.5 साल वाली भी. ठीक है, तो एक सेकंड के लिए तो लगा यार है इनकी क्या कॉलेज खत्म भी हो गया, मेरा तो अभी शुरू हुआ है, मेरे को तो ऐसा लगता है. बट द वेरी नेक्स्ट मोमेंट आई वाज लाइक यस मेरा कॉलेज तो अभी शुरू हुआ है. Let them do वो दुनिया की संभालें, let them do their adulting. मैं तो अपनी कॉलेज लाइफ अपनी एंजॉय कर रहा हूँ, राइट? तो everything has you can view the glass as half full or you can view the glass as half empty, and that's dependent on your perspective. तो तुम कह सकते हो बहुत लंबा है, तुम ये भी कह सकते हो तुम्हारी कॉलेज लाइफ ही इस वजह से बहुत लंबी है.
So it depends. Okay, so now starting with the proper part. Okay, so generally we have 2 exams, like first in FMG exam first in June and second is in December. So 2 attempt होते हैं full साल में. So June attempt is already done. It was on 4th June, and now students are preparing for December attempt. So today is 19th of June, right? So almost 6 months is there.
6 months. 180 दिन मान लेते हैं.
Exam is on 17th of December. So 6 months.
180 दिन मान लेते हैं.
6 months. 180 दिन is there. Okay. Now, what should be the strategy? Like, how many reading one student should do, and how many revisions one should do? क्या strategy?
So I actually
person is starting from tomorrow. Today is Sunday. From Monday he starts.
If somebody would have watched my video with Ashwin, they would have realized that he himself cryptically gave the secret weapon or whatever you want to call it as far as he cleared the FMG exam, and the answer is first aid. First aid, I'm not, people tend to think that I'm promoting a book. I'm not promoting a book. I'm actually surprised. I'm surprised why other people don't know about the book.
Most people know about USMLE के लिए.
Exactly. People tend, Yeah, so people tend to, so everyone who's preparing for USMLE Step 1, they know about it. In fact, anyone who's preparing for their PLAB or MRC, MRCP or everything, when they want to give their basic subject entrances, they also use first aid. And in AIIMS, obviously there has been, like I've told multiple times, there's always a trend to use first aid. But not just AIIMS, I've realized that people who have, when I first posted a video about first aid, back in October, actually, there were at least 4 or 5 comments, people who said that they cracked their JIPPER entrance by using just first aid. They cracked their All India PG entrance back in 2012 or 13 using first aid. And they cracked their whatever entrance, XYZ postgraduate entrance using just first aid. FMG entrance, again, one of them being that. So I believe that first aid actually is a book that is, it's nothing but it's first and second prop, distilled down, very high yield facts given in one single book. Somebody someday did the effort of making sure that what are the most high yield facts, and I will distill them down, and that is being updated year after year by students themselves. If somebody goes to the summary of first aid, actually, they will realize that it's being updated by students, and that list has all the students who have contributed to first aid. And I don't know whether I was there or not, but I also once mailed first aid about certain erratica and my contribution from my side. That was back in the year 2018. I did not check 2019 whether my name was there or not. But considering that name list, if you actually check first aid, has around 2,000 odd students, it's possible that my name was also there. That even at some point of time, when I contributed to making first aid just 0.001% better. So it's a book by the students. So it's a book by the student, of the students, for the students. And somebody did that effort ages ago, 20 years ago, 30 years ago. So it's not a book just for MLE or Step 1. It's a book which is for pretty much any entrance which has first and second prop in it, because it has distilled down and given all the first year facts, first and second year prop facts into that book. So be it your AIIMS entrance, INI-CET entrance, or NEET entrance, or your FMG, that book will be beneficial. Or be it Step 1, MRCS, or whatever exam that you're planning, if it has first and second prop subjects in it. So if somebody's having 180 months right now, my strategy always has been very simple, that you have to do multiple revision in a graded manner.
Okay.
I believe that first reading can be done in around 90 to 100 days. If you were decently regular, I'm not asking you to be topper during your MBBS, but even if you are decently regular, if you passed your exams without cheating, let's say, you were just a normal average student who passed his exams, reading books, average MBBS student. 100 days is sufficient to revise the entire syllabus once.
So almost 3 months.
Around 3 months. So the revision strategy should be such that when you're first doing the revision, I've always said this in multiple times, you're not preparing for the entrance exam, whichever entrance exam, be it NEET PG, be it INI, or be it FMG for that matter. You're preparing to be able to revise the entire syllabus in the 1 week before the exam. Exactly. 1 week or 10 days before the exam. So your preparation in those 100 days should also be geared in a way so that you can revise towards the end. Okay. So for the first 100 days, I'll ask everyone that get to read from whichever source you're reading, be it Maro or Preplad or whatever it is, whatever notes that you had made previously. Go through them. It won't take more than 100 days. 100 days is a lot. If you're regular, dedicated, and you put 10 to 12 hours in on a daily basis, 100 days is a lot. It's 1,000 hours. Yeah. Okay. You can actually watch, if I always keep on criticizing Maro for being very vast, having 850 hours, but you can even watch all the Maro lectures in 100 days if they're actually consistent and regular with it. So my strategy for someone who's preparing for the FMG in the December would be, in 3 months, you should first revise all the subjects and first year ko annotate karo with previous year FMG question. Previous year questions, be it any exam, are extremely important. So in these, be it FMG, be it INI, in this 100 days, they should annotate first aid. You should read through their notes, whatever they made during the 3rd or 4th year, your final year, annotate first aid, okay, for first and second prof, and have one notebook for every other subject. Okay. Like one notebook for medicine, one notebook for
make it concise.
Obs-gynae. Concise notebook, one concise notebook.
Okay.
There are certain resources, for example, Preparada Rapid Revision, I believe, is a very good resource which is for rapid revising. So you can use those notes. But I will actually ideally advise everyone to make their own notes. Actually, I'm planning a video on why your own notes are better than your pre-made notes. I will probably raise,
according to your opinion, pre-made or
handwritten, any day handwritten. So I was going to make a video on this particular topic. I'll release it tomorrow or day after tomorrow. There's a reason behind why handwritten notes are better than pre-made notes. We buy pre-made notes thinking that our efforts are going to get reduced.
Yeah.
But you have to realize that when you're reducing your efforts, if you're reducing your efforts, then you're reducing the result also.
Yeah, true.
That effort that is put in making the notes will result in the result that you're wanting or desiring. When you make handwritten notes, they tend to stay in your memory longer because you have made them, not someone else. And since you have made them, they stay in your memory longer, and they make revision much, much, much easier. Okay. So even if, let's say somebody is using Prepladder or Mara, whatever it is, that the source actually frankly doesn't really matter. Make a set of notes, one notebook, not more than one notebook. Okay. And by notebook, one notebook, I mean not more than 150 to 200 pages. Okay. So first and second prof should be covered in your first aid. Those 600 pages, add previous year question, extra pearls or top small tidbits from whichever resource QBank you're using, add it to first aid. And at the same point of time, practice your previous year FMG questions of those particular topics of first and second prof. And for final prof, for every subject, make one small notebook. Even in that, dermatology and psychiatry actually is given in first aid itself a lot. Psychiatry is given completely. Dermatology, a good portion is given. You can add most of the dermatology into first aid itself, frankly. Okay. And the rest, the big subjects, medicine actually personally will recommend that Dr. Marwa teaches really, really well. If you can actually attend his, have the money to spare for his 6,000-7,000 app में जितने उनके lectures हैं, really concise notes, एक notebook में सारे के सारे आ जाते हैं. Yeah, so really concise notes. So हर subject के एक notebook बना लो, and उसके बाद ये काम तुम्हें करना है पूरा का पूरा 100 दिन में. Okay. ठीक है. इसमें मेहनत करनी है सारी की सारी कि तुम एक रिवाइजेबल सोर्स बना रहे हो खुद के लिए. पहले फर्स्ट एड अच्छे से समझ रहे हो, चीजें फर्स्ट एड में डालते रह रहे हो, फर्स्ट सेकंड प्रॉफ के लिए, फाइनल प्रॉफ के लिए सबके एक नोटबुक्स बना रहे हो. इसके बाद सिर्फ 2 और रिविजन चाहिए तुम्हें. एक रिविजन, वन रिविजन, सो फर्स्ट रिविजन यू डिड इन 100 days, that is revise whatever you have, that is the first reading or revision, whatever you want to say. Then you do one revision in 50 days. 100 में किया था, अब 50 में करो. Okay. ठीक है. Then you do another revision in 25 days. ठीक है. 175 days हो गए. And एक फाइनल रिवीजन 1 week में करनी है. फोर्थ रिवीजन और इसको उल्टी करके आ जाना है. Okay. एग्जाम के दिन. There's absolutely no exam in this world which you won't crack, provided you have annotated your first aid and your notes contain last at least 5 years FMG questions. Okay. ठीक है. प्रीवियस ईयर क्वेश्चन की प्रैक्टिस पहले 3 महीने में सारी अच्छे से करनी है. और टुवर्ड्स द एंड जो सेकंड रिवीजन जो 50 दिन वाली है उसमें भी करते रहना है. ठीक है. आखिरी एक हफ्ते में बैठ के ना ग्रांड टेस्ट का कोई रोल नहीं होता, प्रीवियस ईयर क्वेश्चन सॉल्व करने का कोई रोल नहीं होता. ये सब कुछ तुम्हें पहले करना होता है. ठीक है. उस एक हफ्ते में जो तुमने फाइनली अपना रिसोर्स बना लिया है कि तुम्हारा जो फर्स्ट एड है उसमें तुमने सारे प्रीवियस ईयर क्वेश्चन खुद ही डाल दिए हैं, एनोटेट कर दिया है, your final prof, all your notes which you have already written first aid, you just need to revise it and regurgitate it out, ulti karke aa jao on the exam day. Okay. The entire game is of making sure that you're able to revise the entire syllabus in the last 1 week. And absolutely there's no power in this world that can stop you from clearing your FMG.
Okay. And like you mentioned ki make concise notes of medicine, surgery, obs gynae and pediatrics. PSM. Pediatrics, I'll actually tell you the strategy. So pediatrics is mostly covered in medicine. Okay. For pediatrics, I personally, what I did was you have to make notes of things which are pediatric specific, which are not given everywhere. Like see, nephrotic syndrome is being taught on, exactly. So nephrotic syndrome is being given, leukemias are being given in medicine as well. Hodgkin lymphoma is being taught in medicine as well. So these things will be covered by medicine. Okay. What you have to make sure is in pediatrics, you have to do things which are pediatric specific. So growth and development, basically general pediatrics, growth and development and neonatology. These become very high. Why? Because these are very pediatric specific topics.
So be it any exam, be it INI, be it NEET, or be it your FMG, they will, from pediatrics, even the person who's making pediatrics question won't try to make a question from systemic pediatrics, because even they know that they probably will be covered in either in pathology or pharmacology or medicine.
Exactly.
They will also try to make questions which are very pediatric specific. So what is pediatric specific? Milestones. Milestone is always, there will be one question from milestones irrespective of any exam. True. And this brings me to another thing that I want to tell you, that even in the last 7 days when you're revising now, you should revise in a way that the most volatile subjects are kept towards the end. For example, anatomy. Anatomy should be kept towards the end. Okay. Certain topics in pediatrics. So development milestone, no matter how many times, I am a pediatrician, I did my MD in pediatrics. I, for love of God, cannot remember milestones.
Exactly.
Okay.
I
as an MD pediatrics,
like, it's very.
I as an MD pediatrics will tell you I don't remember milestones. I as an MD pediatrics will tell you none of my batchmates remember milestones unless they are doing DM in pediatric neurology. Then they might remember. Divya might remember pediatric milestones because she's interested in pediatric neurology. But none of my batchmates is interested in pediatric neurology. None of them will remember milestones by heart. It's impossible. It's humanly impossible. So during my PG entrance examination also, the very last thing that I did revising before entering the entrance exam. So my exam was in Noida. My parents dropped me there and I was going through my last 20th. So I was basically going to the last page of first aid. Okay. And just before entering the exam, I took out my mobile phone. Usme I had taken pictures of those 4 boxes of milestones. I read them. Ki abhi padh ke jana hai.
Just exams.
You will remember milestone for just this minute, just this 20-30 minutes, not more than. And as luck, I'm not kidding, as luck would have it, the very first question in my was on milestone.
Oh, confidence aaya hoga.
But usi se main answer kiya na aage badha. I have not remembered milestones before that. I have not remembered milestones after that. Very frankly. Okay. Even during my MD pediatrics final exam, during my, my final practical exams, I know they are going to ask the milestones. So just before entering the ward, when I read the milestones. Okay. And remembered it for that 1.5 hour duration. Because utne der hi yaad rehte hain. No matter how great your memory is, you won't remember milestone for more than 3 to 4 hours. Okay. So you have to plan your revision also in that 1 week. Okay, anatomy is very volatile. So plan it towards the end. Okay, pharmacology, I was good in pharmacology, so I revised pharmacology 3-4 days back. But like people say, pharmacology tends to be pharmacology is something which people tend to believe that it's volatile. So keep it towards the end. Path is something which people tend to remember a lot. So keep it in that 7 day, keep it on the first day itself.
I wanted to ask one more thing related to notes. Okay, like you said, if someone is using any app, let it be X app. Okay, prepare mero video mein. Okay. So you said you say notes banane ke liye. But if someone is making, like if someone is watching the video and making the notes, then those notes won't be concise, right? Wo notes so obviously 600 pages tak jayenge. So
fair point.
Notes. Then make a concise note, a directly concise note make from video itself.
Directly concise notes बनाओ वीडियो से, because अगर इन 3 महीने में तुम्हें बनाना है तो मैं वही कह रहा हूँ, ये 3 महीने की, these 3 months are to be so let's assume this is a battle. Okay, let's assume FMG is a battle. It's a war that you have to win. Okay, so the first 3 months you are essentially collecting all your resources for this battle. Okay. You are getting into partnerships with different people for this battle. And these partnerships are your apps. These partnerships are first aid. Okay. This partnership is XYZ lecture that you're taking. Let's say you took Deepak Mawa specific lectures. So you got into 3 partnerships with the ASRS so that they support you in this battle. One was first aid. One is your app and it's QBack. One is specifically for, let's say, medicine. You wanted concise notes. That was Dr. Deepak Marwa, for example. Okay. These 3 months are to make sure that your resources are in place. Okay, these 100 days basically. So when you're making notes, let's say from the video lectures, now how to make concise notes from the video lectures, because obviously like you said that they will be 600 pages long, 700 pages long, and we have to make them 200. Essentially, we have to reduce them to 1/3. or 1/4 if I want to make it 150. So there are two ways to go about it. So this is something which was excellently discussed in Sanal Garg. There's an interview that I did with Sanal. He said that he was able to reduce his 600 pages notes into 30 pages.
30 pages.
Now, I'm not asking you to, I'm not asking you to do 600 to 330 pages because it's frankly, that was his talent. Okay. A lot of people commented on that video that please get us those 30 pages notes. See, they're not going to be useful for you. And I'll tell you why. So let's say you read a particular topic, you are doing, give me an XYZ topic, give me an example of some topic. Let's say you are doing pediatrics. Okay. Let's assume you're doing pediatrics and let's say you're doing neonatology, for example, for the matter of fact. You're doing neonatology and you're doing neonatal jaundice. Okay. So what you have to do is in those notes, what you have to make sure that let's say they tell you 20 facts. And this is something that he told me, and that's actually how you have to make concise notes. They will tell you 20 facts. Okay, this is why previous year questions become important. If you've done previous year question or you do previous year question immediately after watching that video in order to make notes, what you'll realize is that questions have always come from 5 or maybe 6 of those 20 facts that are presented to you. Questions have always come from 3 or maybe 4 facts. Okay. So those 3 facts and those previous year questions facts have to be there in your notes. That's a given, right? Things which are almost related to it should be there.
Okay.
Okay. So that becomes 8 facts. Okay. And maybe 1 or 2 facts that you think you need to put in there to be able to revise it for your understanding. Okay. So this way, those 20 facts will get distilled down to 10 facts. There will be certain facts which will be useless, have never been asked and will never be asked. I'll actually give you an example on this. Today I was just browsing my internet. Go and see Dr. Rohan. There's a video on extradural hematoma. Okay. There's a video on extradural hematoma, Dr. Rohan Khandelwal's marrow. Okay. It's a very long video. Okay. And I was just going through I'll tell you something personally. I did not do surgery from Dr. Rohan Khandelwal. So I actually watched that video to see why people keep on praising him. And I watched that video and realized that he definitely is an excellent teacher. Okay. Go and watch that video. You'll realize that whenever they have asked a question about extradural hemorrhage or subdural hemorrhage or subarachnoid hemorrhage, most of the time the question has focused upon, if you do the previous year question, you will realize most of the time the question is focused either on presentation. Okay. Or the radiological image.
Yeah. Most of the
or if the management, most of the times the radiological image. And if they have asked about management, they have asked very specific things, which calcium channel blocker can be used in subarachnoid hemorrhage, or which surgical management can be done. Okay. Go and watch his video carefully. He talks about very specific things in that surgical management. That if EDH is more than this 1.5 centimeter, midline shift itni hui hai, nahi hui hai. Agar tumne previous year question kiye honge, you will realize that these extra points that he's telling you for completion's sake. Okay, they will never be asked. There are 2 minute details that will never be asked in the exam. Exam is about a broad conceptual understanding that whether you are able to identify and separate subarachnoid hemorrhage and its presentation from extradural hemorrhage and its presentation or subdural hemorrhage and its presentation. All right. So the exam is going to focus on this. It won't ever ask you 1.5 mm shift hai, 2.5 mm shift hai, and that will be given in your notes. And this is the funneling down, and this is the wo kya kehte hain na chhatna in Hindi. This sieving, that this is something you yourself have to do. And if you practice previous year question, you yourself realize it will make it easier for you to sieve through this. Okay, so let's assume that you already know that EDH में image जो होती है, जो NCT का image है, वो ऐसी होती है. So maybe you don't even put it in your note. Okay. Or maybe you know that is there in first aid, so I don't need to put it in my surgery notes. So when I'm doing my first aid, I'll obviously revise it, but I don't need to put it in my surgery notes. So this way the surgery notes will very, very specifically boil down to the 2-3 question, very, very high yield facts. Okay. So this is the way you, exactly. So this is the way you have to funnel down those 20 facts to those 8 or 10 facts. So those 600 pages will become 300 pages. And in the second reading, those 300 pages also, you will realize, okay, only these 200 pages are what are more important. And you'll get down to it.
That's a really like excellent idea, like to concise notes, because बहुत सारे स्टूडेंट की यही डाउट है, like how to concise, like जैसे I am like आपसे मैं बात कर रहा हूँ, okay?
Concise notes, your concise notes are always made with the help of previous year question. When you do previous year question or solve previous year questions, you will, so there is something called as a retrospective method of learning, in which you first solve questions, see their concepts, and then do the pura topic. And I believe that that can actually be done to make concise notes. You solve the previous year question, you will get to know, okay, these are the topics that they are asking again and again. And that will also help you filter out that, okay, these are some things which are too much in detail, never been asked. So why will they ask now? Exactly. So if you would have watched the Tamasha, it's a very indirect example, actually, very frankly. So in Tamasha, there is a song called Chali Kahani. I don't know whether you have heard this or not, Keshav. Chali Kahani, Chali Kahani, Chali Kahani Re. Have you watched Tamasha movie, by the way? Ranveer Kapoor and Deepika Padukone.
I watched, but गाने याद नहीं मेरे को.
In the very beginning, there is a song by Sukhvinder Singh. It says, Charles से चली कहानी, वक्त जुबान की है यही कहानी, आती जहां से काती कहां से क्या पता. So that's, if you watch that song is that the story has always remained the same, and it has been continuing time and again, and has been told multiple times in different way. Okay, that beat Ram Sita, beats क्या कहते हैं Romeo Juliet, or beat Ranja Majnu Laila, ठीक है, all are similar stories but have been told multiple times in different formats. In Hindi Heartland, or William Shakespeare, or Ramayana, whatever it is, ठीक है. So this is valid as far as your entrance examination is also considered. They will keep on asking the same concepts again and again and again, just in a different way, to test your understanding of that concept. Okay, so you have to do this previous year question to get into the examiner's head कि okay, उसको यही ज़्यादा पसंद है, and उससे अपने notes को concise कर लो. तुम्हें अपने notes concise बनाने में, I know it gets a bit tough. It was tough for me as well. It's not like I got a hang of how to make notes. Even I also felt that sometimes my notes were a bit too extensive. But you do get a hang of it. And more importantly, if you have written them down now, so maybe 600 pages is not revisable, but 300 pages, even your handwritten notes are revisable.
For handwritten notes are revisable. If it's 300.
Handwritten notes are 200, 300 pages are revised. Okay. So that's why you have to focus on making your own handwritten notes and then funneling them down. कि ये चीज, okay, maybe I've already done it from anatomy में हो जाएगा मेरे से cover. छोड़ो, सर्जरी के टाइम पे नहीं पढ़ूंगा, काटा मार दो. ये चीज फर्स्ट एड में ऑलरेडी दी हुई है, काटा मार दो. तो सर्जरी अपने आप धीरे-धीरे और करके फनल डाउन होती रहेगी. Right?
And where, like you mentioned about previous
same for medicine. Medicine is path and pharma.
That is already covered in
first aid. My medicine notes focus on, especially on those topics which are exclusively medicine. They focus on clinical science, which are not there in first and second prof, let's assume. They focus on ECG, they focus on ABGs, they focused on again the exact electrolyte imbalance examination में जो पूछा जाता है. You know, sometimes they ask you कि rheumatoid arthritis में वो swan neck होता है, ये होता है. ये चीज obviously, when we read about rheumatoid arthritis in pathology, we'll read about the HLA associations, we'll read about the synovial destruction and things like that. But उसकी clinical manifestation जो बुटनी या swan neck है, वो medicine में है. So my medicine notes were always were concise in a way that they were exclusively medicine. They did not touch the pharma and the pathology aspect because I knew that I will be doing them from first aid itself. So that way you can funnel down medicine, that way you can funnel down surgery as well. The only subject that is not funneled down in this way is obs-gynae. And obs-gynae ko pad lena dhang se. You can do actually obs-gynae, you can put some amount of efforts. Obviously some subjects are tough to funnel down. You can put that much amount of effort as far as obs-gynae is concerned.
कुछ तो रहेगा ना करने के लिए. सारा ही concise.
Obviously. सब कुछ ही concise.
I'll tell you one funny. बहुत सारे बच्चे concise का मतलब पता क्या समझते हैं? वो और notes को ना और छोटा कर देंगे. उनकी writing छोटी हो जाएगी और वो और छोटे में कर देंगे. तो 2 पेज में जो लिखा
है. Even frankly, as far as first aid concerned, even that thing can help. I'm not like, going to disregard that. If you have made it at one, so one problem with revision also is that you would not know from where to revise. You should also know from where to revise. तो sometimes ये छोटा लिखने की वजह से ये होता है ना, तुम्हें पता होता है कि मेरे को यहाँ से रिवाइज करना है, तो एक ही जगह है at least. So that way, even that thing is beneficial. But obviously, concise का मतलब यही होता है that you are actively removing something which A are not going to be asked, are not that high yield, or B, you already know you think you will remember them because of your basal memory or because of your basal knowledge.
Yeah. Okay. So now I have to specifically want to ask about two subjects. First is anatomy.
Okay.
Second is PSM.
PSM.
How to
remember? So yeah, anatomy to is like anatomy for me always was like, so anatomy ke liye what I used to did was I did I'll be very frank, मैंने तो Ashwin sir के TND के notes किए थे, that's it.
Just TND notes.
So TND just not TND के notes, TND notes along with uski images from netters. Okay. So TND notes, images from netters, उससे related वो थोड़ी बहुत जो relevant anatomy और जो relevant वो है वो देखा, और anatomy को I did on the last day. I revised anatomy on the last day because I knew I won't remember anatomy for more than that. Okay. ठीक है. As far as PSM is concerned, so I will divide PSM into 3 parts. Okay. I'll divide PSM first part will be epidemiology and biostatistics.
That is interesting.
So that is interesting, and I'll say epidemiology and biostatistics. I'll actually advise, even at this point of time, you do have enough time that you can watch Dr. Stephen Dorothy videos from Kaplan.
Okay.
If you think you are going to give 6-7 days to PSM in that 90 or 100-day schedule, if you're going to give 5 days, you can actually finish those epidemiology videos in 1 day. Okay. And and you can annotate them then onto first aid. First aid has decent enough epidemiology and biostatistics. Okay. So that portion of PSM, I think Kaplan covered for me. I did them in my 7th or 8th prof. And those videos, Dr. Stephen Dorothy videos, are excellent. Very, very mind-blowingly, really, really good, actually, for that matter of fact. Okay. That's something which I always recommend. The second part is the disease part of your PSM. PSM also talks about smallpox, chickenpox, and your non-communicable diseases. I find even this people can understand better. So you can take help of bit of pediatrics and take bit of help of your medicine to make this thing interesting. And इससे थोड़े बहुत national programs and related stuff को डाल दो. Finally comes the third part of PSM, which is the worst and the least important and most boring part of PSM, which is your programs, which is your कि कितने type के toilets होते हैं, कितने type के घर होते हैं, and stuff like that basically. ठीक है. So उसमें तो यार I'll say कि बस रट्टा मारना ही है. इन चीजों को एंड के लिए और कुछ है नहीं. You just have to rote memorize them. Okay. So I did these. तो हाँ, तो इसमें स्टार्टिंग से रट्टा मारने की जरूरत नहीं है. इनके notes बना लो, like so I think Dr. Vivek Jain's book in this regard is very, very nice. So as far as programs are considered, so programs में Dr. Vivek Jain book में जितने program के बारे में जो जितना chapter दिया हुआ है, just write that down and revise it, and during the last 7 days, 4 to 5 days before. बस उतना याद रखो और उसके बाद उल्टी मार के आ जाओ. ठीक है. This is, I think, the way you can go about PSM.
Okay. I think subjects are covered. One more thing. Like, can you give an idea? Like you said, 100 days for first reading. Okay. Can you give an idea like how much time one should give for one particular subject? Like if it's a small subject, is it 5 days, 10 days?
So I think subjects like derma and psychiatry can actually be covered in 2-3 days. Okay. Psychiatry can actually be done in 2, maximum 3 days. So Dr. Praveen Tripathi की जो book आती है, it's an excellent book. और अगर तुम्हारे पास even pre-made notes हो for that matter नहीं है आपके, तो उसमें सिर्फ previous year question वाला part को first aid में डाल दो. जितना first aid में, that's more than enough as far as psychiatry is concerned. Same as far as derma is concerned. Okay. So in चीजों के लिए 2 या 3 दिन more than enough. So let's say psychiatry plus derma plus anesthesia 7 days, 8 days. Okay. A first prof subject can be given 5 to 7 days. So physio can be done in 5 to 6 days. Bio can be done in 7 days. Big subjects can be taken as 10 days. So medicine you can consider taking 8 to 10 days. Surgery you can consider taking 8 to 10 days. Obscene you can consider taking 8 to 10 days. And the rest subject should be done in 1 week. In this way, you'll be able to cover. So short subject should be covered in 2 to 3 days.
Okay.
So psychiatry should be covered, try to be covered in 2 to 3 days. Soma 2 to 3 days. Anesthesia 1 to 2 days. Your what else is left? Sorry, orthopedics again 3 to 4 days. ठीक है. Optha में थोड़ा ज़्यादा टाइम ले सकते हो, 5 दिन ले सकते हो, थोड़ी सी टफ होती है. Radio के लिए 1 दिन, not more than that. In fact, I do not consider radiology to be a subject. I think if you want to make a separate notebook, exactly. So if you want to make radiology as a subject, what you can actually do is that take another notebook whenever you are doing your medicine and surgery. Whatever radiological images are being discussed in that particular aspect, write them down separately in another notebook, and that will be your radiology notebook. You don't need to do radiology separately. Okay. And even for anesthesia, for that matter of fact, anesthesia, 50% of the questions of anesthesia are just pharma questions from the anesthetic drugs. So do them during the pharmacology itself and don't bother about that. The remaining part of pharmacology, write one separate notebook and try to finish it in 1.5 days. Okay. You have ENT again, half the questions are from anatomy most of the times. Okay. So during your anatomy, when you're doing anatomy over 7 to 10 days, give a 1 day proper to ear. Let it be for your ear anatomy and your nose anatomy and throat anatomy, and your ENT also is done in that way. So you should not never give ENT all these subjects more than 2 or 3 days. You'll be wasting time, frankly. Okay. For first and second prof subjects, 5 to 7 days, depending upon your ease with the subject. For example, I will take 5 days with pharmacology, 5 days with pathology, and maybe 8 days or 9 days with micro, because micro was not that strong. Other people might take 7 days with pathology, pharmacology, and the micro was probably a bit stronger. They can take 5 days. So that way you can adjust it in that. And the big subjects, 8 to 10 days.
Okay. And so this is first reading is done. Now you already said 100 days for first reading, 50 days for second revision, and 25 days for third revision. Now comes the final part. Fourth revision, 7 days.
7 days. 7 days, yeah.
How to schedule? That's the main thing, right? How to schedule the first kya karna hai, second kya karna hai?
Scheduling is simple depending upon your memory. You are the best judge of your memory. But I'll give you the best example I give is that I'll take example of 2 very volatile subjects. One is biochemistry and one is anatomy. Okay. I was very strong in biochemistry. I was weak in anatomy. If you watch Rishabh's video, you will realize Rishabh was very strong in anatomy. Rishabh was very weak in biochemistry. So on the last day, I revised anatomy. I revised biochemistry on the day -5, day -6. Okay. He revised biochemistry on day -1. He revised anatomy on day -7.
Okay.
So it should be based on your strengths and weaknesses. Subjects which you think you will tend to remember more. The certain subjects which everyone tends to remember more. Pathology, medicine. These subjects are to be done on day -7 and day -6. They tend to be remembered for longer. Okay. And the subjects which are more volatile. Anatomy, biochemistry, and your parts of pharmacology, they should be done in the last 2 to 3 days. In fact, I'll actually suggest to everyone that you should try to make one notebook in which you write specific topics which are very volatile with each subject. So I had, with each subject actually, I had a notebook where I had written volatile subjects of, volatile topics of each subject. For example, well, forensic was a decent, not a very strong subject, not a weak subject. So I probably would have done it 3 or maybe 4 days back. Okay. But I knew that I won't be able to remember IPC if I don't do it in the last day. Okay. So I did it on the last day itself, along with anatomy. Similarly, although pediatrics probably was done 4 or 5 days before, or 6 days actually. Okay. The neonatology part, but milestones, I knew that I have to go just before the exam. I have to do it. So for every subject, take out some 2-3 topics which you have to do on the last day, but just before the exam. Similarly, as far as pharmacology and epidemiology is considered, while the rest, most of the things were, I knew I was strong. I did make it a point to revise all the formulas just 1 day before the exam. Okay. So this way you have to schedule a revision.
Okay. All right. Thank you so much, Bhaiya, for this very informative and itna badhiya session ke liye, and all the strategies you gave and all the schedule you told, and about the first aid also, because ab to apne itni videos already you made kya formal se use kar raha hu.
I know. I think actually somebody commented upon this on Twitter कि आपने एक नया FOMO create कर दिया first aid का. तो कोई मेरे को कह रहा था कि तुम आप इन्फ्लुएंसर हो, मैंने कहा अच्छा ठीक है, मैंने कहा कि आपने फोमो क्रिएट कर दिया, मैंने कहा हाँ, मतलब ये आई विल एग्री दैट दिस इज वन स्मॉल फोमो, बट दिस इज आई एम absolutely proud of creating this FOMO because first it is that good a book.
That's true. Yeah.
Anyone who uses it won't ever come and tell me that galat book aapne suggest ki.
I agree.
Okay. है ना, अगर उसको अच्छे से annotate कर दो, you put your previous year questions into it, nobody will ever come and tell me that this was a wrong book that you suggested. Okay.
So thank you so much, Bhaiya, and it was great having you on this session. Thank you. Thanks a lot.
Thank you.
And so any final message you want to give to our audience, to FMGs or whoever is watching?
देखो यार, सारी strategy मैं बता सकता हूँ. I can tell you the resources as well. I can tell you the plus points, negative points and everything. End में ना, the effort, that is yours. Okay. All this is useless if you don't put 10 to 12 hours on a daily basis. If you put 10 to 12 or 2-3 days and next 2-3 days you are drunk or going on a party or meeting a girlfriend, you won't clear your exam. Okay. I lost my, not lost my, I had a breakup because of my exam, during my PG entrance examination. Okay. But you have to realize what is more important in your life. Clearing this exam, for me, clearing my PG entrance exam was superior to that relationship. And let me tell you, the breakup will always be in such a scenario be temporary. After that, again, started dating that particular girl. Obviously not for long, for 2-3 months only. But the point basically I'm trying to make is that you have to put in the efforts and you have to be consistent. Two things are very important. Being consistent, doing it daily. You have to put in some 6 to 7 hours to 10 hours on a daily basis. And obviously the second part is the hard work that you have to put in. You cannot clear it without hard work. You cannot, strategy पता चल जाएगी, उससे कुछ नहीं होने वाला until unless you actually put efforts. So यही है मेरा आखिरी end में मैं यही बोलूँगा.
आप hang हुए थे भी बीच में, end में last.
Okay.
But आवाज आ गई.
That's okay.
So thank you so much, Bhaiya, and it was a great session.
Thank you.
Thank you. Thanks.
Thank you.